I'm happy to give you a brief update though for unhappy information. I've shared with you information about these take-home COVID tests that we are piloting, and talk to you about an update on surveillance testing. It appears as if we're in this transitional process with the AOE. So what I know right now is that surveillance testing may be stopping in the format that it already exists, but it may not. Either way, we're still waiting for support from them. The AOE has talked to Medical Reserve Corps and National Guard. They're also trying to hire people. Many schools, many districts do not have the personnel to execute. And frankly, if you haven't heard, just as an aside, there are districts right now closing because they cannot keep up with contact tracing due to COVID right now in their schools. Schools closing, districts closing in order to do the work. So we are looking at significant personnel issues. You know, you heard Caroline talking about issues of paras as well. So we, because of sort of, I think my pretty consistent communication with the AOE about surveillance testing and how much I wanted to conduct it, but didn't have the resources, we were invited to be a part of a pilot group of districts to pilot these take-home COVID tests. So the COVID tests were supposed to come at the end of last week. And essentially, we could give them to somebody if they were sick. If somebody needed to quarantine, we could give it to them and say, hey, take this test on whatever day is, you know, the appropriate time as determined by the Department of Health. And then people can bring them back to us and we'll ship them for them through UPS, or they can take it and drop it off at their UPS store or with their UPS driver. And the free shipping, quick, easier way for families to navigate the testing process. So lots of positive feedback about that from families, from staff. So we got at the SU on Friday 40 test kits. We did not know whether all the other schools also got kits, but we were supposed to have hundreds of them. So we weren't sure what this 40 represented. Come to find out, that was it. That was the delivery for the SU, were these 40. We figured that out late Friday. So today, some schools, because they knew that we had gotten a shipment, were already starting to say to families, hey, we've got some test kits, because some kids are symptomatic or kids are quarantining. So we immediately this morning start to look at the tests. That's, you know, we realized not everybody had them. How are we going to get them out to people? And then we realized that they sent us the wrong kits. Nothing was labeled. There's no shipping. There's no ability to process them. Oops, we sent you the wrong things. So this is sort of what it is like right now, trying to navigate this. And they're also trying to come up with another initiative. So I just want to let you know that we are staying as vigilant as we can be. It is not an easy, simple process. Some families who thought they were going to get a test kit are pretty upset right now, and understandably so. I'm trying to work with a nurse to figure out other ways that we can support this family. How might we be able to do it? We've got test kits. Can we somehow get them to the families and somehow ship them someplace? But that's not possible, because I don't need to go into details with you of the logistics of that, but it's just a mess. And we're trying, and I just want to make you aware of it. It's not smooth sailing for us. So that's the only piece I'll add. Jane?
Yeah, I actually had an in-depth conversation with Dr. Stone from Urgent Care in Manchester last week. And the phenomenon that's happening, and I'm wondering if maybe it's getting to be maybe something that school boards might want to consider writing a letter about, which is, you know, we're seeing that really what needs to be happening medically in order to have enough tests, if you will, and for it to really do its job, is to really be using the antigen tests instead of the PCR tests. I mean, just to give you an example, last week, Dr. Stone was saying he was supposed to get like 2,500 PCR tests. He was down to his last 20. I mean, it's getting to be alarming. And I really think that this whole thing with everybody using PCR tests it's really creating a problem throughout the entire state. Yes.
I think that you got a good point, but at the same time, that's the Department of Health and trying to deal with that. The antigen versus the PCR. I guess it's kind of hard for us to fight that battle, with Dr. Levine. I think at this point, is that fair or not?
I think if we were to say something with a no, I mean, I guess what I just want to say is, because I know talking with Dr. Stone and some other medical providers, I think there's a lot of discussion going around that maybe it's time for more advocacy that the antigen test be used properly in these kind of instances when you're dealing with large numbers and you're trying to isolate.
Yeah, I've seen some good arguments that sort of the other countries and all as well. But I think it's a really good point. It's just
yeah, the Department of Health is talking about ways in which antigen tests can be used appropriately at schools. There are other states that are doing that right now. They're looking at the models. They're in discussion about that. So when I talk about other things happening, that's another avenue. It's just hard to have confidence right now in what may or may not happen.
There are a lot of other countries that are doing that, pretty exclusively too. I mean,
we never really got on the testing bandwagon at the beginning the way that most other countries did. We didn't contact trace the same way that they did overseas.
Okay. Other points you wanted to raise?
Nope, that's it.